Hello, everyone. Greetings from Arizona. I live here in the Sedona vortex, very interesting, energetic place to live. So, for those of you who don't know me or are unfamiliar with my work, uh, I'm medically trained. I studied at Johns Hopkins back in the prehistoric era. And I was for many years an art historian. And I realized during that time I was also a cultural historian. So I began to look at medical issues from a historical perspective and the impact of those kinds of issues on cultures throughout history. So then there wasn't much interest in having cultural historians on faculties in those days. And after I met Peter Levine and we began teaching somatic experiencing, this took as a trauma recovery method. This took me back into medicine and psychology and so forth. And so I went back to universities and got more degrees in psychology and social change. So at that point, Peter and I were really looking at trauma in the individual nervous system. And there's a lot to do there. There's a lot to know. The work is ongoing, unfolding. And because I was already a historian, I was very attracted to Bert Hellinger's view that there are more systems that come into play with trauma than the individual nervous system. So I met Bert in 1997 during his first trip to the US. He came to Boulder, Colorado, and it was a very small workshop because here people didn't really know who he was. And most of the people, I think there were maybe 15 of us there, most of the participants were German. And I had been teaching somatic experiencing in Munich, and I knew about Bert Hellinger. But for me, he was this uptight old priest who was putting everything in order. And, I was working with vortexes and chaos, and I didn't think what he was offering was relevant to trauma. And of course, I was very surprised when this lovely gentleman arrived and sat down, and no introduction, nothing. No PowerPoint, no handouts, no reading list. He just sat down and he said, "Okay, who wants to work?" And I thought, just like that, just who wants to work? Yeah, who wants to work? And he started setting up constellations. And of course, all the Germans wanted to work because they knew who he was. And he set up a constellation, and people began shaking. The representative doing this, and I thought, this is very strange. And Bert was very calm, and he looked at the constellation and he said, "Of course, there's been a murder." And I thought, a murder? I don't see a murder. What's it? But it turned out, in fact, in this system, there was hidden the murder of a child. So how did he know that? And that's trauma. And he was working with the informational field. Now, we were working with the informational field in trauma as well, because Peter Levine is, of course, a physicist, in addition to being a psychologist. So we knew about the informational field, but we didn't know how to use it clinically. And I thought, wow, here's somebody who knows how to apply his knowledge of the informational field, his relationship to the field, to traumatized people and systems. And I realized, oh, Bert knows how to address not only the nervous system, but the family system. And then eventually, as his work evolved, he moved away from only family system to larger systems, to systems in organization, systems in tribal consciousness, in countries, even the biosphere. So he began referring to the work as systemic constellation work, which is larger than the family. And of course, being a historian, I began looking for patterns within transgenerational trauma. So when I was still working together with Peter in a medical practice in Boulder, it was something new for the community there to have trauma specialists in medical clinics. And so the response was many of the doctors in the community sent us every patient they didn't know what to do with. And this included a lot of chronic pain patients because they're not very satisfying to work with sometimes because they don't respond to allopathic protocols sometimes. And our premise was, well, maybe there's an underlying trauma that hasn't been resolved, and this is why the patients aren't responding to allopathic methods. What I found when I looked at the stack of charts on my desk is that I had maybe 20, 30 cases of people who had been, for the most part, in automobile accidents and a few in airplane accidents. And these people, as I went through the charts, had repeatedly had accidents. And being still in a linear mode, I thought, well, obviously there's some sort of substance abuse issue going on here. They're addicted to something or other. I went through all the charts and no. So I had a mystery. Why were these people having repetitive accidents? Why were these traumas repeating? Now, trauma specialists know that traumas do repeat, and they repeat transgenerationally. We know this, but when we were told, especially in my marriage and family training, is this was a coincidence. However, I wasn't satisfied with that. And I began to do quite a bit of research, which took me about 20 years to figure out why traumas repeat. And I found out that this had something to do with fractal geometry, fractal dynamics. And I've written 2 books about that if you're interested in the details. So with systemic constellation work, it was it was possible to actually see the fractal patterns. You could see in the constellations often where the traumatic patterns originated. And what I found is they would originate when something was denied or covered up or unresolved. So what would happen is similar circumstances would, quote, reconstellate in subsequent generations in the interest of resolution. Now, in some cultures, these replicating patterns are called curses. there's a very interesting video you might want to look at. I think there's a transcript of it somewhere. The video, I think it's at the Hellinger Institute. You can get it. I think it's a DVD now. On is there such a thing as curses? And the conversation was between Bert Hellinger and Rupert Sheldrake, who was convinced is that places have fields of memory, and this is important. And the French psychiatrist, who's now passed, Madame Anngwyn St. So they had a three-way discussion. And the short version is, yes, these patterns do repeat down through the ages, and you can trace this back in world literature, back to the Trojan War, and, the Odyssey, the Iliad, Shakespeare, and more modern literature as well, with Edgar Allan Poe and so forth. So Hellinger's view is a little bit different, although he acknowledged the existence of these disturbing patterns. His feeling was that on the meta level, on the greater level, that these patterns, which are often dangerous, reconstitute in the interest of healing. So they keep showing up until they're resolved, which is a more optimistic way of looking at them. So at one point, I think it was in Mexico City around 2016, Bert gave a very important talk about what he called the greater forces. And since then, it seems like my particular role in the international community has been to bring the message that history matters. It's very simple. Excuse me. So, history matters. And Bert knew this. And somehow this message didn't quite land because people were still very attached to family constellations. And early on, they were not so willing to look at patterns in the collective. That's changed, and that's a good thing. So, sorry. In Bert's talk in Mexico City, he talked about what he called the greater forces. And I think this has been, or maybe it's less now, a blind spot in constellation work because there's still a little bit of hangover from marriage and family therapy for those of us who came into the field from that trajectory, or psychotherapy. But systemic constellation work is really something quite different. So, oh my. So, Bert talked about the greater forces that shape individual lives, relationships, families, tribes, movements, organizations, and larger systems, even the biosystem. So, what are these greater forces that Bert was talking about? Well, as a historian, I recognize them immediately. Of course, they are war. How many therapists ever ask a client, was anybody in your family ever in a war? It's a very interesting question. I'm very, can be very important, excuse me. Spring allergy season has arrived in Arizona. So, war. So, if you have war, often you have famine. You have, famine can be man-made or it can be natural. You can have also, if you have war and you have famine, you have epidemics. Now, epidemics are, in fact, a very powerful force of social change. And I think we've seen this recently with the COVID agenda. It was a powerful element in social change globally. And this is nothing new. Um, it's very interesting if you look at historical fractals. And as a graduate student, when I was still an art historian, I was looking at the impact of the Black Plague on 13th, 14th century art. And basically, the Black Plague decimated 3/5 of Europe and completely reconfigured the social structure because they went from the feudal system, which didn't work anymore because there were no more peasants, not enough peasants to do the labor. So the lords had to pay them if they wanted them to work. So the feudal system gave way to what became moving from the medieval era into the Renaissance. Very different social structure, thanks to the plague. There wasn't one plague, there were a series of plagues, actually, around 1348. Anyway, what I found out is these series of Black plagues originated in Wuhan, China. So, how did that happen? Well, the fleas on the rats that were carrying the pathogen came along the Silk Road to the Mediterranean and then got on the ships. And when they arrived in France and Italy and so forth, it began to go north. And so the plague spread that way. So there's a historical fractal. Again, just looking at epidemics and social change. So also the greater forces include religion, economic collapse, natural disasters, and immigration and emigration. So when you have the other factors, you also have immigration and immigration. And for those of us who grew up in countries which had many, many immigrants coming from many different places, the question for us working systemically is where did they come from in our own lineage or partner's lineage? Where did they come from? Why did they leave? And who is left behind? And this was a very important insight that Bert Hellinger had because he would ask who was left behind and what happened to them. Because very often the people who immigrated either excluded or forgot, um, somehow disconnected from whoever was left behind. If they had a difficult fate, sometimes they remain entangled. So when we talk about immigration, in my experience, there wasn't much interest in who was left behind. And how do you find out? Well, the field knows who was left behind, and the field knows what happened to them. And I was listening to a talk that Jan Jakob Stam gave recently. He said, whatever hidden can control the system. So, working with families, it's like, well, we don't know. We don't know how to know. Nobody knows. And sort of, the agreement was, well, we don't know, so it doesn't matter. Or we don't know, or we can't know. So Yes, you can, because the informational field knows. So for me, this opened up a whole new way of working. And I didn't talk to Bert about many of the greater forces. But, since then, I would add radiation. I think radiation has been one of the greater forces that have shaped history, that have shaped individual lives, families, transgenerational issues. And radiation is a reality since uh, the atomic testing began. And of course, when the bombs were finally detonated in Japan, that the consequences from that and nuclear power plants and so nuclear testing in the southern hemisphere and in Russia and so forth is ongoing. And I think that radiation has been a catalyst for social change as well. So in my work, when people have an issue, I'm very interested in the context, because over time, I've learned that symptoms don't come out of nowhere, that generally there's a context. And the context in this way of working is not to find a diagnosis. That's not what I'm doing anymore. But to find out what's the context. There's simple questions like, does anyone else in your life or your system have anything like this? When did this begin? What was going on in your life when this began? And we can do this kind of work with ourselves. For example, what year were you born? What was going on in the family when you were born? What's the birth order? And again, as Bert found out, many of us are not very clear about birth order because there could have been pregnancies we don't know about. And now, since we have ultrasound, we know that between 60 and 80% of human conceptions are multiple, and that these early conceptions are often reabsorbed, and we didn't know about them before ultrasound. So the whole realm of lost twin. And of course, it's not only twins. Sometimes if twins are having difficulty, we find out they were maybe triplets and someone is missing, and that's causing disturbance in the relationship. Or maybe triplets, maybe there was a fourth, and I did work with quadruplets who were having trouble, and it turned out that they were in fact 5. So where did your parents meet? It's a simple question, but it will give you a lot of information. Where did your parents meet? What year was that? Where were they? What was going on in the region where they were when they met? And what was going on in the world when they met? What was going on in the world when you were born? And to begin to look at the system in terms of a historical context involving the greater forces. Okay, so I've been talking for quite a while now. I'm wondering if you have questions about why history matters and the difference between family constellation work and systemic constellation work. Oh, I see hands. Okay. Lena?
Hi, thank you so much. So I'm actually a triplet, and both of my sisters were, when I got my twins, when my twins were born, my twin sons, I actually had some lump here and they diagnosed it. And I've done a lot of healing work, but I mean, not from with the family constellation. So what would you think would be missing? What's the missing link or sort of?
Well, triplets is a clue. Were you all identical?
Well, actually, I have not asked myself that question.
Well, we have the resource in the informational field. Set it up and see what the representatives, because they know. Okay.
So we have a question in the chat. One
Okay.
participant says it's the second time someone speaks about fractal, and she's not sure if they've got the correct understanding. And could you kind of clarify a little bit on that?
Sure. And again, I've written 2 books about it. Trauma and fractals. So the short version is there have always been fractals, but we didn't call them fractals. And they weren't really discovered and named as fractals until the 1980s, when a mathematician whose name was Benoit Mandelbrot was working with a very early primitive version of computer. And he thought there was something wrong with his computer because he would type in an equation and then the computer would give him these patterns. So he thought there was definitely something wrong with the computer. So he went and had some coffee. He came back and he put in some more equations, and each of the equations had a different pattern. And these were self-replicating patterns. And what that means is whatever magnitude the pattern, they were self-similar. So he began to call these fractals. Now, if you really want to know about fractals, I think the easiest way is there's a film on YouTube in many languages, and it's called The Colors of Infinity. And it's narrated by Arthur C. Clarke. And it's about the discovery of fractals, what they look like, and how they replicate, and what this means for our understanding of nature. If, for example, we all are familiar with fractal patterns. For example, you remember Leonardo da Vinci's drawing of the Nautilus shell, which is the Fibonacci spiral, is a fractal. And you see it again in seashells, you see it in fiddlehead ferns, you see it if you look through the microscope or the telescope, you're going to see the same image in a spiral galaxy as you're going to see in little protozoo. So self-similar, as above, so below. And here's, for me, the most interesting point is that human beings are fractal, and that we have many fractals in our body. So if you just gently press on your eyelids for a while, you'll see them. They're there. They're in your fingerprints. They're in your ear canals. They're in the fallopian tubes. Now this is very important, they're in the circulatory system. So if you look at the venous and arterial systems in a human body, and then you look at the aerial photographs of rivers and branches that are going to the sea, you will see the same pattern as the river goes into a stream that goes into a delta. Okay, same. Okay, you see it in trees. You see the branch Well, you see the tree, then you see the branch, and then you see the edge of the twig. Okay, so when I was getting really excited about fractals, I brought this up with Bert Hellinger. And he said, well, because I was watching him work, and I said, Bert, you're working with fractals. And he said, because he was showing replicating patterns throughout generations. And I said, you're working with fractals? And he said, yes, but I don't call it that. He said, I don't say it, but when I'm working with someone, I see them very much like a tree that has a branch, and the branch has leaves, and that this person is a piece of the leaf from this tree, which has a larger place in the greater landscape. Now, you remember, some of you, when the Russians developed Karelian photography, they could take a piece of a leaf, photograph it, and the field would show the whole pattern. And that's what Bert was doing when he was working with replicating patterns. So the big discovery came for me when I realized, aha, I'm a trauma specialist. I work with the human nervous system. The human nervous system is fractal. If you look at the pattern of the axons and the dendrites, they look exactly like tree branches with twigs. And there are these synapses, these spaces, which we thought initially were empty, but they're not empty. They're filled with what's now known as microtubules. Now, this all came to light through the collaborative work of a physicist who recently got the Nobel Prize, Sir Roger Penrose, quantum physicist. And he collaborated with Dr. Stuart Hameroff here in Arizona. And what they found is that these synapses were filled with these microtubules, which were fractal, as is our DNA. The double spiral is fractal. So we are fractal creatures in a fractal universe. So they are proposing that it's in these synapse spaces where we have our microtubules that we are in resonance with the greater fractal universe, also the informational field, that there is, in fact, a physiological basis for attunement with the field through our microtubule nervous system. So that's the short version about fractals. And they're beautiful. So please do see the film. It's very well done. Colors of Infinity. Okay, more questions?
Wonderful. Got a question. Could you briefly explain the difference between family constellations and systemic constellations?
Mm-hmm. Yeah, family constellation is concerned with the family system and concerned, and it is really quite different from marriage and family therapy, as I trained as a marriage and family therapist. And we were looking at issues like, grandfather was an alcoholic and grandmother was depressed. And we didn't look at any of the greater forces as they were impacting the family system. Although we had these wonderful maps with genograms where we could see these patterns, but there was no understanding about, hey, there was a war, there was a revolution, there was, no, grandfather was a drunk, and no. So with systemic family work, what we're doing is Bert was not interested in diagnosing a grandfather's or grandmother's depression. He was interested in balancing the system. It's different. It's not the medical model. So this went on for quite a while because as he was discovering that people could actually represent and that information from the field could come into why things were out of balance, why the love didn't flow, what was in the way, what was hidden, and so forth. It was a lot to learn. But then he became interested in larger systems than the family because it was obvious to him that the family, the shape of the family, the imbalances in the family, what's hidden in the families had a lot to do with what was going on within the larger systems that they were part of. So he changed the name of his work from family constellation work to systemic constellation work. And he began in Germany by working on the Holocaust, which was a major collective trauma that impacted individual lives, relationships, family patterns for generations. And also the history of Germany and other countries that followed this particular agenda. So he began working with the Holocaust in terms of focus on the victim-perpetrator dynamics. And this was fascinating. It was very unexpected, which eventually evolved into a version of his work, which he called Movement of the Soul. And then, excuse me, in that version of the work, Movement of the Soul, the representatives don't speak. And if there's a perpetrator-victim dynamic, it's most successfully resolved after death on the soul level. And what he found is if you set up the victim and the perpetrator, no talking, sooner or later, they're going to fall in love and fall down on the floor together. Now, this was, I mean, wait a minute, what about justice? Who's right, who's wrong? No, none of that matters on the soul level. And then he formulated exercises doing that. And Dr. Albert Marr was doing work along the same line. And the understanding of the victim-perpetrator dynamic took on a whole nother dimension and expanded into other areas. Of course, when Bert was working in South America, there was a lot going on with victim-perpetrator dynamics for generations, with colonialism and all that was involved with that, with land grabs, with religious persecution, with slavery, and so on. So this remains a very rich area to explore, but it's much larger than the family. The family is not in a bubble. The family is part of other systems. And some of those systems are very, very powerful. And to try to understand the family without looking at the greater forces that shape them is limiting, I feel. Anyway. Any other questions or?
Yes, we've got a few questions coming in. So Francesca says she's seen you observe people's clothing and note something historical. Could you share how your interview or facilitation process interface with seeing history in the system?
Could you repeat the question, Maggie?
So can you share how your interview or facilitation process interface with seeing history in the system? As she's observed you noting people's clothing and something historical during the process.
Sure. I was an art historian, and I did a lot of work with portraiture. And in portraiture, the artist had some limitation as to how they could portray what was important about this person. And very often it was important information about the sitter was in their clothing. So I learned early on to look at my client. And it's, in the psychotherapy training, we were taught to listen to the client. Well, yes, but not to look. And, what I found in looking at the client, people wear their issues and their resources. And sometimes it's very, very obvious, and sometimes not so. So jewelry is a clue. Color, lack of color. Sometimes you'll see middle-aged people dressed like toddlers or teenagers. So then okay, what happened when you were 2? What happened when you were 14, 16? So is the outfit age appropriate? If not, are people sometimes dressing older than they really, teenagers look like little old ladies? Well, what's that about? Okay, so I get laughed at about this, oh, this American lady, all she cares about is fashion. And, I like fashion, but it's important to look, excuse me, at the people we're working with. So I was at a conference in Mexico City, and there's a gentleman sitting there, and he said, well, I don't believe any of this crap, He said, well, what can you tell about me from what I'm wearing? So I said, okay, come sit. So he came and he sat, and he was wearing casual clothes. He had kind of a rust-colored t-shirt, khaki shorts, brown shoes, no jewelry, no. So I looked at him and I thought, oh. So I said, well, what I'm noticing is you're wearing all earth colors. Is the earth, the colors of the earth important to you? He said, yes, I'm a geologist. Okay. So there it was. It's not only about what they're wearing, but what they're not wearing. And one has to be very careful, of course, because you don't want to be doing a fashion critique when somebody comes to you for help with a very serious issue. So I don't always disclose what I'm seeing or sensing from the outfit. Does that answer your question?
Hey, thank you. And a question from Lucretia. Is it possible to practice systemic constellations in pairs or on your own?
People do. Results vary. Someone else?
And there's a more generalized question, I think, on the same theme of if you know of any systemic constellation facilitators who focused on more on collective healing. For instance, constellations on the ongoing conflicts in the world and global issues.
Yeah, Dr. Karl-Heinz Rauscher, for one. Early on, Dr. Albrecht Marr had a group looking at political constellations. Unfortunately, it was only in German. My German wasn't good enough to be able to be a part of that, but I saw him working in some of our Hellinger conferences where he worked on the Armenian genocide and things like that. So more and more people are looking at the collective. Even Peter Levine has come around to expressing an interest in looking at the collective. So yeah, there's more than a few doing that.
And going back to our previous question, Irina has asked if you could recommend one of your books where they can get more information about looking at the presentation of the person, the outfit and colors in order to understand more the personality.
I never wrote that down. I've written 10 books. One is in German. 5 are also in Spanish. An introduction to my work. The book I suppose, best known for is Trauma, Time, Space, and Fractals, volumes 1 and 2. Yeah. And I've done a series of interviews with Jeffrey Misloff on New Thinking Aloud. That's on YouTube. But I never wrote down, no, I never did. I did present at the fashion conference at the Italian embassy in Budapest about the relationship between fashion and cultural trauma, but that was not recorded. It was a very interesting group. They were all fashion people. And half the group was fascinated and half the group was half asleep. So they weren't quite ready to look at their fashion in terms of anything but fashion.
Thank you. And Shilpa asks, according to your experience in trauma-related work, does the nervous system heal completely after family constellation work?
I think results vary. What I have noticed is there is very often a positive shift toward what I call relative balance. I wrote a book about that. I called it Relative Balance in an Unstable World. I think the nervous system goes in and out of balance regularly. What I do know is that humans are resilient. The capacity for healing is there. But systemic constellation work was never really presented as a means for healing trauma or balancing the nervous system. Bert's vision was that it was about balancing systems. So I have to repeat myself, results vary.
And Marta asks, would you say that when we work with the family and other systems, that it impacts the collective?
Both ways. Both ways. Because the collective is made up of other systems. So when there's a profound shift in the other systems, then the collective is reacting. I think we're seeing that now with the COVID agenda. So follow that one, because I think we're going to see some interesting examples of the relationship between the individual, the groups, and the collective.
Thank you, Anngwyn. And how would you say the skills acquired in family constellation training directly translate into impactful contributions in the real world?
Well, I see that more in the work with the collective. That there's been, until recently, a real resistance to looking at collective issues because they might be political. And guess what? The collective is political. And you can't be doing work with collective trauma and say, well, I'm not going to look at politics. Well, that's that doesn't work. And, with the internet and the international conferences and so forth, that some of these really powerful constellations having to do with the collective are seen by thousands, if not millions of people. And I think that has to have an impact.
Thank you. Helena says, can you say more about the synaptic space and the informational field?
Yeah, that's in Time, Space, and Fractals, Volume 2. You can read it. The microtube, you can look this up on the internet. There's a lot of information by Penrose and Hammeroff about microtubules as antenna, kind of antenna or transmitters that facilitate the interaction of humans with the larger fractal universe. So the information is there, and it's free.
And could you say how family constellation training or family and systemic constellation training uniquely contributes to significant personal and professional growth?
Can you repeat that?
Of course. How does family FSC training uniquely contribute to significant personal and professional growth?
Oh, I think it certainly has the potential for that, because in order to facilitate family systems, we need to know something about our own system. And it's interesting how many facilitators don't know. Oh yeah, we don't know anything about mother's side, end of story. And it's like, well, to really get deeper into other people's systems, we really need to keep digging into our own, because the nature of the informational field is such that not all of the information that we need comes all at once. It sometimes comes in a kind of time release through dreams or coincidence or synchronicity. Ooh, where's that coming from? So it's an ongoing process. And in my experience, there's always more to know. And one of the ways you can know that you have a blind spot is the clients who keep coming to you have this issue, and you don't think you do. And then it's like, wait a minute. Is it possible that this is also something for my system too that we haven't looked at.
Excuse me. We have a follow-up question from Shilpa. Saying, with family constellations, when the nervous system is balanced, are there any instances where you have experienced magical results with clients through this work?
Dramatic results?
Magical results was her wording.
You know, sometimes the whole thing seems magical to me. And, you know, there have been times when I did what I thought was good work and didn't seem to land. Years later, I'll get a letter saying that it was life-changing. And I've learned, the results of the constellation is not really up to me. That it's between the client and the field, and then I have a part in that, but I can't fix anyone's life. And sometimes people come to constellation work expecting, please fix my family, fix my relationship, fix my husband, fix my wife, fix my kid. No, it's much larger than that. And, Bert was very clear that there is an element, a very strong element of mystery to this work, which for me is awesome. So, I'm not so impressed with double-blind studies about the efficacy of constellation work for this or that. All I have is my own experience, my relationship with Bert, what I learned from him, what my colleagues are discovering. And it's not about measuring, it's not about statistics. And sometimes the full effect of the work doesn't manifest for immediately or for a very long time. And, at one point, people were asking Bert, how do you protect yourself working in toxic fields or difficult fields? And do you do ceremonies? Do you beat drums or prayers, whatever? And he said, no. He says it's very simple. He said the best protection is your humility. And I think that's true. And I think that's a good place to be when looking at the question of how effective is what I'm doing really. So it seems like we're close to running out of time. And I want to just say what I've been saying all along, which you're probably tired of hearing, which is that people who are working with people in the healing and helping professions need to pay attention to history. And unfortunately, for whatever reasons you can imagine, history is no longer taught in public schools, at least in this country. And it's a blind spot, particularly when you think about the impact of the greater forces on systems. So my message has been to shine a little bit of light on this blind spot and hope that people will move beyond diagnoses and psychotherapy and to look at what shaped this person, their relationship, their family, their culture, their religion, and so on. History matters.
Thank you so much for a beautiful session today, Anngwyn. It's been precious
My
to have
pleasure.
you here today.
And I'm so looking forward to coming to Lisbon.
And for those who don't know already, Anngwyn will be coming along for the intensive in Lisbon. So if you want more information, I've put some links in the chat. And it's going to be a wonderful opportunity to meet some of our esteemed faculty in person.